Hello, my name is Chase Pat, and today we'll be talking about how to treat a minor wound. Have you ever found yourself in a situation where someone had a cut or an injury and you did not know what to do? Being able to properly treat a cut or wound is imperative to everyday life. Every day someone is injured at work, home, or at their job. It could be something as simple as a paper cut to a knife wound, but it can be handled with any proper training on the steps that we will go over today. Everyone will face this situation, no matter who you are, and it's most likely that in the next month alone, you will see someone that had a minor cut or wound that was not properly treated. I've been an EMT for 2 years, and I've seen many minor wounds in my time, and it is surprising to me how many people didn't know how to properly treat the situation. Today we will be going over how to assess a wound, the equipment we will be using to treat the wound, and then the proper treatment itself. The first thing when you see an injury is to assess it. You want to get an overlay of the wound so you can properly understand what to do with that wound. The key factors in a wound are its depth, its width, and is it clean. You want to be able to already be gathering an idea of how to treat this wound. What will it take and what proper equipment will I be using? If at any time you feel the wound is beyond your care, you immediately want to seek higher medical care. Do not ever treat a wound you do not feel comfortable with. The key pieces of equipment that we will be using today are from a med kit supported by the Red Cross. This includes gauze pads, gloves, antibacterial hand cleaner, triple antibiotic ointment for the wound itself, different types of band-aids and bandages, medical tape, and anything else that we might need, you want to include in your med kit if you feel is pertinent to the job at hand. And the steps to treat is first you want to make sure the wound is clean and any debris has been removed. To properly clean, you want to adone your gloves, stop blood flow. Evidence shows that most minor wounds will have blood flow that is instantly stopped by the wound itself. Your body will naturally heal it. Anything that bleeds beyond that might be beyond your medical care. You want to wipe the wound down. Evidence has shown that cleaning bacteria from the wound is one of the first and major steps in proper healing of the said wound. Now, when we want to remove debris, we want to make sure that we have the proper equipment at hand, and that if we do remove this debris, it will not cause any more damage to the affected victim. Now, when it comes to finishing treatment, you want to employ your proper barriers. This includes automatically donning your gloves, and then ways to make a proper barrier are band-aids, bandages, and gauze. You want to apply these as much as you feel to the wound where it is properly treated. Do not ever overlap band-aids, gauze, or anything in a situation where the pressure is not firmly supporting the wound. Now, important things to mention about a wound to the patient are they need to keep it dry. Wetness can infect a wound and it helps bacteria grow. Do not scratch the wound. If it's on a joint, suggest they try not to move that joint as much as possible. Minor cuts, it's not so pertinent, but it might be depending on the joint. And the most important thing is they want to change that bandage regularly. Changing bandages is also shown by our evidence a great way to reduce that bacteria. Now, in conclusion, do not fret. If you follow those simple steps in your mind when you come across a wound, you will be able to properly treat it, and it'll make worrying about such wounds an inconvenience and a thing of the past. In closing, next time you come across a minor cut or wound, rest easy. If you follow these steps, you will be able to properly treat it, and you will be able to leave that victim knowing that both of you provided medical care for that victim, and that they are satisfied with that wound has been properly treated and they've been educated about how to take care of it.